Are you worried that you'll just continue to create worse health problems for yourself moving forward in 2025, not knowing how to manage your long-term health and performance alongside the chaos of business? If you use this scientifically backed method that I learned during my master's degree working with elite athletes, you won't have to waste any time in 2025. So I'll break it down so it's really simple. The overview is applying something called a minimum effective dose through evidence-based training to achieve long-term health and performance results in the most efficient and effective way possible. Which does sound really complicated, but once you break it down, it's actually really simple. So before you do anything, you need to start by working out some clear, measurable outcomes. Choose a specific length of time, like 6 months, and at the end of those 6 months, you need to write down exactly what you want to weigh, how you want your physique to look when thinking about your body fat percentage and muscle mass. Have a couple of clear health outcomes that you want to change, like lowering your blood pressure, and then have some physical performance goals, like running a 5K in a certain amount of time or lifting a certain amount of weight. Then you use evidence-based training to construct your plan. So starting off, use the relevant science to put together your physical and nutrition plan. You should then consult with a relevant expert to apply this plan specifically for you. And I am offering 30-minute consultation calls if you want some guidance with this. But what the expert will do is break down the daily habits, both inside the gym and outside the gym, along with your nutrition that you need to specifically stick to enable you to achieve a certain amount of progress each week that aligns with the end goal at the end of those 6 months. The last thing you need to do is track data that is directly linked to the end outcome you're trying to achieve. For example, tracking calories and steps for weight loss. It's only by tracking data that you can know if you're applying something called a minimum effective dose. And all a minimum effective dose is essentially doing the least amount of work to make the exact progress you need to make each day and each week to get you to the end outcome at that 6 months. Using this data, you can constantly course correct by reducing the amount of work you're doing if things are going too quick, but then also by increasing the amount of work you need to do if you're not getting to your goals at the rate you should be. Or what it will do is give you the awareness of what you're actually capable of doing with the capacity that you have to then change the time frame you're giving to achieving this end goal, so you can be a little bit more realistic and make sure you still get there without stressing about it.